When you think of that experience, and I want you to just do it briefly, just for a little while, just to get information so that you can let me know. You don't need to go into it and all that stuff. When you think of this intrusive thought, how do you represent it? And I mean by this, do you have an image? Does this image have sounds? How far away is the image? Is it bright? Is it color? Is it three-dimensional? Various things like that. You understand?
Yeah, I understand the question, you know. It's an image.
And it's pretty much straight in front of you.
Yeah.
How far away?
It's sort of difficult, you know, to say how far away it is, you know. But it is three-dimensional. Yeah.
Three-dimensional? Does it kind of wrap around you? Is it almost like you're back there? Or do you have some distance from it?
There's some distance from it.
So it's a little hard. So it's three-dimensional. Is it life-size?
Nah. I would say it's smaller than life-size, you know, more like a picture than like an animal, you know? Yeah.
Like a picture. Okay. Does it have a frame around it?
Nah.
Okay. And does it have sound?
Yeah.
The sounds that were occurring in that particular event? Okay. And just tell me a little bit about the feelings that you're having as a result of that. Do you have some tension, and it's obviously unpleasant for you?
I feel like my heart is racing, you know? Yeah. Breathing shallow and fast.
Okay.
An uncomfortable feeling running from my chest into my arm, you know?
And is this typical of what you experience when you have these intrusive thoughts in daily life?
I hadn't really thought about it. The image is quite the same, you know?
Okay, the image is the same. And the feeling?
I hadn't really thought about it. Haven't really paid any attention to it, you know? Yeah.
All right. Okay. So follow the yellow tip here. And again, let me know if I go too fast. And the goal is to have nice, smooth movement while you're thinking of that disturbing experience. Nice, smooth movement. Just follow. That's right.
Now we will take a quick break while Rocky does his brief training session.
Hey, yo, Parody, look how I do this beef right here. Look how I hit this beef right here, Parody. It's why I'm the champ, Parody. It's why I'm the man. I'm Rocky Balboa. Hey, yo, Adrian, look how I hit this beef right here. Adrian! I'm hitting this beef right here.
Training complete.
Think of those sounds now.
Well, I can breathe during the sounds now, you know?
Okay. So your breathing is freer. Okay. Any change in the intensity of your feeling there?
Yeah, that's gone.
You sure? Check to be sure. It's great if it's gone. I just want to be sure. Okay. Now, thinking of all your experiences in Vietnam and all these ones that you've processed here, or this whole segment, I want you to try as hard as you can to get back the original, because when you came up here, there were tears in your eyes, you were feeling something quite strongly, right? Is there any way that you can utilize those images? Is there any way that you can bring that back? Or are you irrevocably broken? Because if you can get them back in any way, I want to continue. And if you really can't get them back now, then I'm basically done.
Nah, Doc, you know I can't get the images back, you know? I guess you're done. Thanks for healing me. Hey, yo, keep punching. Hey yo, again, I really appreciate you coming by and watching my video. It took me a couple hours to put everything together. Everything had to be timed and everything had to be cut and clipped. And sometimes my brain, it doesn't work right and I forget things, I'm not punchy or anything, It's just, I have what's called a relaxed brain, Adrian! I don't chill with the garlic and this mac and cheese over here. Jeez. She goes heavy with the garlic. Y'all take it easy.